It's longer video time. Today's topic is about arthritis, but not just any arthritis, because that would just mean inflammation of a joint. But we're specifically talking about the good old osteoarthritis. Osteobone, arthritis, degeneration of that bone, cartilage breakdown, narrowing of the joint space, which causes a bunch of stiffness and pain. So let's get into it. Osteoarthritis is a disease process that affects cartilage, ligaments, and chondral lining of the bone. It can start as affecting one area of the joint, but it is a progressive process, eventually infecting the entire joint. It takes decades to develop and can be either primary, meaning genetic, or due to life-related factors, manual labor job, body habitus, being a football player, or secondary, meaning due to an injury, surgery, or something like gout or rheumatoid arthritis, which is an autoimmune process. Symptoms can include a global pain all over the knee, or maybe a person will feel the pain on one side of the joint or another, to include the back of the knee. X-rays can show normal joint space with a little bit of change of the knee, or it may show moderate to severe changes of the joint space narrowing and bone spur formation, till eventually folks can rub bone on bone. So treatment. Generally, you can start with medications such as Tylenol, ibuprofen, topical ointments, over the counter, or prescribed. Some people like a more holistic approach, which can mean glucosamine and chondroitin sulfate, which are natural nutrients of the knee, herbs like matcha powder, which come in a drink or a capsule, turmeric also, which can be cooked with, used as a drink, or taken in the form of a capsule, ginger, which you can do the same with, and magnesium, which can even come in a spray in addition to an over-the-counter supplement. We also emphasize movement. About 85% of people or so get better if they just work on their strength around the problem. You strengthen around the problem, you take pressure off of it. Yoga and Tai Chi are also ways to strengthen and gain more flexibility as well. Physical therapy is helpful, especially if the exercises you do on your own aren't helping, because they can lay another set of eyes on you and tailor the strength and conditioning routine to your needs. Also, some therapists use hot and cold and ultrasound techniques, dry needling, and other modalities to help relax those muscles and make you feel better. We emphasize nutrition. Less carbs and sugar and more good fats and anti-inflammatory foods like spinach and berries can help with the pain as well. Sometimes we use injections with steroid or the gel injection, which is hyaluronic acid, the stuff naturally in your knee, to help the motor oil that keeps things lubricated. Both of these things can help with inflammation and pain. If someone cannot tolerate land exercises, we recommend getting in the pool if possible, as you are essentially weightless in the water, so the exercises are easier and the joints are protected against gravity. In addition to nerve blocks, low-dose radiation to the arthritic joint is the newer kid on the block, in that very low doses of this type of therapy can help achieve pain relief. Lastly, we do discuss knee replacement as a permanent pain reliever, as the concept is if you can remove the bad bone and replace it with prosthetic, you can stop the pain and restore function. A lot of my patients ask me, so doc, when do I need a knee replacement? And I always say knee replacements are elective, meaning not life or death, right? It's not like you need a new heart or a new set of lungs. And x-rays never dictate how people feel. Some people could have a little arthritis and feel every bit of it, while others have the worst arthritis you might have seen on an x-ray, but they feel nothing. So I always say exhaust all your possibilities. And at the end of that exhaustion of the things, if you're still having functional pain, functional deficit, meaning falling, crawling, can't stand up, take a shower, well, my friend, it might be time to consider one, meaning go talk to your doctors about it, talk to your orthopedist about it, know all of the risk benefits, everything surrounding preoperative, postoperative care, et cetera, and then make an informed decision. Knowledge is power, so you want to make sure that a knee replacement is for you. But again, don't let anybody ever bully you into one. Just think about how you feel and what you need to do for you. Any other questions about osteoarthritis? Well, hit me up in the comments and I'll be happy to answer you.